Today on this video we're going to be talking about the final few weeks of pregnancy, and I'm going to give you some very practical tips of what you can be doing as you approach the end of the pregnancy and the birth of your baby to help to cope with the symptoms that you might be feeling towards the end, and also some practical things that you can do in order to ease your labour and birth. First up, staying active in pregnancy is really important throughout, right from the beginning of the first trimester all the way through. I fully encourage women to stay active and safe wherever possible, so under the guidance of your doctor. But if it's safe for you, maintaining exercise and the ability to move your body will really help. It helps to reduce your risk of certain complications of pregnancy, like premature labour, like blood pressure problems and gestational diabetes. And it also helps with a lot of the pelvic pain and joint pain that you get. And the thing about pregnancy is, because of the hormones that you have that are trying to get your body ready for birth, what they do is they loosen up your joints, they loosen your ligaments in order to allow your pelvis to open up more, which is great for birth, but it's not so great for the pain that we might feel during pregnancy. And so whilst I fully encourage you to continue your normal exercise if you exercised regularly in the past, or just taking up gentle exercise even if you didn't previously exercise much, that can be really difficult advice to follow when you're feeling really tired and also you have pain in your pelvis and in your back. One way to help yourself cope with that is to use something like a support belt. So as you guys know, I'm a big fan of bbhugme. I love their pregnancy pillows, and especially if you do suffer with pelvic pain, then it's really worth considering investing in one of those. And I've got a blog post about how to use a pregnancy pillow for sleep as well, if that's an issue for you. And bbhugme have just brought out a brand new product, which is a 2-in-1 maternity belt, and I've got one here. And so what using a belt like this will do is allows you the support that you might need in order to keep moving about. So it's 2-in-1 because it's got a belly band which gives you the support around your bump, especially if you feel that that's a bit loose and you require a bit more support in that area. And then it's also got this band, the lower part of the band, which is a tougher fabric and is adjustable with Velcro, and basically allows you to bind your pelvis, applying pressure to those joints that are moving around too much. And by applying that pressure there, that can really help to ease any discomfort as the joints move around on each other. So I think it's a great belt to wear on an everyday basis if you're having pain just on walking around, getting in and out of the car, getting in and out of bed, then by all means you can wear it under your normal clothing. But also when you do decide to do exercise, that's a good time to wear the belt to help to provide that extra support, almost like a weightlifter would wear a weightlifting belt. So that's staying active in pregnancy. And as you approach those final few weeks, you might be thinking about how to get yourself into labour. And so from once you're 37 weeks onwards, it's even more important to stay active, because if you regularly go for walks up and down hills or up and down the stairs, then that will help you to go into labour, into spontaneous labour earlier. So if you're trying to get yourself into labour, that's a top tip for you there. My second top tip for something that you can do in those final few weeks of pregnancy is something that can help you to prepare for birth. So I'm a big fan of hypnobirthing, and hypnobirthing is not just kind of a yoga kind of technique. It's actually something that can be practiced throughout your pregnancy and then used during labour as a technique to help you to cope with the pain of contractions. And there is evidence to say that using hypnobirthing in labour can reduce the likelihood that women need certain types of medication to help to cope with the pain. And it's not just about avoiding certain types of pain relief. I think hypnobirthing is a great tool because it can allow you, by having control over your breathing techniques and also over your own mindset, it can allow you to cope better with the kind of difficult, ever-changing situation that's going on around you on a busy labour ward, and as well as seeing it used successfully in women having a low risk vaginal birth. I've also seen it used successfully with women having a cesarean section, even in an emergency situation, because practicing hypnobirthing techniques allows you to acknowledge everything that's going on around you and then to focus again, and to focus on your breathing technique to sort of hypnotize yourself, and gives you back some of the power and control when you feel like everything's been taken away from you. So if you're interested in finding more out about hypnobirthing, I've got a page about it on my blog, but also you can find a course near you. So there's lots of people that will teach face-to-face hypnobirthing courses, and there's also online courses and audio books where you can listen to tapes to help you to guide your breathing techniques, and then you can practice this on a regular basis during those final weeks of your pregnancy so that they're there and available for you to use when your labour does begin. My final tip for you today is something practical that you could be doing in the final weeks of pregnancy, is to think about perineal massage. So perineal massage is used to stretch the perineum, which is the important part of your anatomy that gets stretched during the birth of your baby. As your baby's head crowns, there's a risk that that skin and that muscle tissue can tear. And we're not just worried about kind of the superficial tears. What we're more concerned with is severe tears, tears that extend towards the anus and the anal sphincter, and that can give you problems down the line. So by practicing a technique such as perineal massage, which means stretching that area on a regular basis, that can reduce the risk of you having tears or episiotomy. I recommend practicing this technique from around 35-36 weeks of pregnancy on a regular basis, so around 2 to 3 times per week it should be sufficient. And there's a video with the technique on my blog, so search for perineal massage, and that can help you identify the correct technique. And the only thing that you need for it is a lubricant. You can use some household oils like coconut oil or olive oil, but don't use the ones from your kitchen, or you can use a pregnancy specific lubricant, such as the Yes company make a pregnancy specific lubricant, and just with a bit of lubricant and your fingers you can gently stretch the area to reduce the risk of you having any tears during the birth of your baby. So those are some useful techniques and tips that you can use just to get you through those final weeks of pregnancy. So good luck for your birth, and follow me on Instagram for lots more top tips, and also don't forget to subscribe to my YouTube channel for more videos like this.